Okay. Okay. So maybe as just a quick introduction, and for those who don't know APACMed or MTAA, APACMed is a nonprofit association of some of the leading top tier medical technology corporations, such as Baxter, Johnson & Johnson, Olympus, Medtronics, you name it. And of course, focused on Asia, but it also includes a startup community, a very good startup community, ranging from everything from data, diagnostics, digital therapies, and all the way down to care. And obviously that's a very big area. So we've been working on a startup program for a couple of years now, and it's gotten a lot of traction, and we want to continue to do that. And that's along with a alliance with MTAA. So the way to think about APACMed is that we do at the core work with regulatory bodies and other legal folks in the community in order to get market access for large corporations, but we're also supporting our large corporations and the startup community in terms of collaboration, partnerships, and potential opportunities. So that's where our motivation is coming from, where our history comes from, and why we think it's so exciting going forward. And I'll leave it to Merrilyn to introduce herself and MTAA.
Hi there, Merrilyn Clancy. I've had a very long career in healthcare management. If you can think of a way in which healthcare could be delivered, I've probably worked in that setting, first in Australia, but mostly the USA, where I lived for 30 years. I'm currently living in Sydney, Australia, and my area of focus is policy and advocacy in healthcare. MTAA, the Medical Technology Association of Australia, is a not-for-profit association that represents companies that make medical technology for use in healthcare. So any non-pharmaceutical product that you can think of for diagnosis or treatment. So the companies who join us contribute directly to good healthcare for all Australians, and we support them through education, training, policy, and advocacy. Our members abide by a code of conduct that embraces ethics, principles of engagement, so that best practice and innovation can thrive. In my role, my specific role, I oversee areas such as industry policy, procurement, startups, and manufacturers. So if you're a manufacturer or you're a local manufacturer here in Australia, I'm your go-to person. Back to you, Dennis.
Yeah, I'm really excited about this because I can't imagine a better partner on the ground in Australia for our startup community in terms of just guidance, whatever process or stage you're in, and what other expertise. If they don't have the answer, I'm sure they could find it. So thank you, Merrilyn, for making all this happen. Let's jump into the program so you get a feel for what we're offering and what's possible. Again, I don't think any 100% shrink wrapped offering that would make everybody happy. The idea is really that we put some basic things together that we know startups need, and also multinationals, so that you can at least start there. And then of course we work with you and collaborate as needed. So it's ultimately it's a 1 + 1 = 3, and hopefully for as many people as possible. Okay, now let's advance these slides. And this is the reason why we're doing it. And I think this is a pretty interesting slide. You look at what's happened in the past, since 1980, when the internet came, right? Advertising has made a huge transformation. Retail, and now it's education and healthcare. And these bars are skewed in a way. I mean, healthcare, if you look at the ratio between what is spent today in the blue and what will be spent in the green, that is 100-fold increase. So it'll be even a bigger phenomenon and transition. Now, as we all know, but healthcare is a lot different, so it'll take a little bit of time. But we're all on this path together. And I think, of course, we have got great purpose, and we're doing things that are really quite important, right? Health outcomes worldwide. And so digital health, health tech, these are very important things, and that's why we think it's important that we're collaborating and providing as much support to you. And here's just an example. We already, just in APACMed, in 2 years, have more than 120 startups as members. And quite honestly, that's not enough. There should be thousands and thousands, just even looking at Korea or Japan alone. So we're very excited to get this going. And here's an example of some of these well-known startups that are making headlines and raising capital all along what is research, diagnostics, therapeutics, and even connected care, or horizontally in terms of systems or data or analytics like AI. And all these are, all these companies we love and we think are going to be tremendous. It's no longer the traditional med tech. This is now what has happened in e-commerce as well as advertising. This is health on a digital scale. So what we want to do is put together this shared mission. After talking with the likes of Johnson & Johnson, all the strategic folks, the R&D folks, the executives, as well as Stryker and Baxter and Roche. Everybody's been building up these programs, whether it's an incubator or whether it's their business development teams, but they still need more engagement from the startups, and they want to work with you. And their coverage is, quite honestly, is still not good enough. So here we are. We want to bring everybody together. We want to understand what the potential is, fill in the gaps, and then start matching people up. So that, let's say you need a go-to-market partner. Well, we'll probably have a pretty good idea about which company might be interested in based on your solution or disease area or your market focus or stage of development. Or maybe you're just looking for some kind of expertise or support. Or maybe you're looking for an exit or funding, pre-exit. All those are possibilities. And that will go along with the ecosystem that we'll continue to build, not only just between us here, Australia and Singapore, but also other countries, and then other players, whether it's VC, academics, or researchers. Merrilyn, is there anything else you wanted to add to that?
Yeah, so it's obvious what some of the issues are for startups that you may have in common, but in particular at this time, from now until the end of the year, we want to hear from you what matters to you most. And from there, we will slot that in with unique ways we can address that. That is separate from our other work at MTAA and APACMed.
Fair point, and great transition. Let's go through a few slides just to give you a snapshot of what already is on the table or on the buffet. Okay, this is just a summary kind of slide, just to what we just spoke about. On one side we have the multinationals, and the other side we have the startup community, and both are looking for, whether it's pipeline or potential partners and acquisitions, or whether it's development partners or solutions developers and accelerator labs. All these, that's the need, and underneath are all these possibilities, whether it's pilots, funding, or capabilities, and we can help match that, but we need to know more about what you're doing and where you're going and what you want.
Yeah, we can also help in relation to funding. One example is startups typically take a problem and a solution to an investor, but that's not what they need to hear. And so we can help you align your presentation with what a funding person or body or company is looking for. So they're looking for that you've considered risks. They're seeking information about what's in it for them in terms of timeline for investment and what stage you're at. We are connected with people who fund very, very early startups, all the way through to people who fund mid-stage startups. So it's not just connecting you with the people, but rather ensuring your mindset and your materials are aligned with something that will be effective.
I see one question. So let's see if I can make this happen for us before we jump into the rest of the material. Alicia, did you have a question? Feel free to just talk. You need to unmute. Okay, we'll come back to you. Or if you want to type in your question, we can do that too if I can figure it out. Hold on. Okay, let's keep going. Alicia, hold on to your question because I know it's going to be a good one. So thank you. So after talking with a lot of our startups as well, you know, and scanning what is the ecosystem right now in Singapore, there's lots of pre-seed and seed help available. So you have the likes of Verge or Health Capital or SG Innovate. You know, a lot of the government-backed programs looking to support the Singapore agenda. And then at the other end, you have all these great incubators and great corporations and VCs like Sequoia. But there's still probably a big gap, an important gap in between what is pre-seed or seed and then Series A and then to be going to seed. And in that area, you've got a lot of hard work to do, particularly in the area of a POV or a clinical pilot with independent empirical validation or some kind of a market assessment. And that's where I think we can play quite well. And so if you're in that phase, we should be talking. Okay. Oh, jumping ahead. And some of these more tangible, concrete programs could be a number of things. So what we would do and what we have been doing for now 2 quarters is the startup community, particularly people will engage, get a better understanding, deeper understanding of where they're going, what their management team's looking like, what's the solution, etc. And then based on that, we also know kind of what our members in corporate development are looking for, whether it's Siemens, Medtronic, J&J. That probably is the first point or first stop in what might be their journey, and to see how much corporate interest there are in alignment, because that could lead to very big things. If it's not exactly a fit right away, then maybe we go to a corporate accelerator or some other accelerator program. There's lots of them out there, some that just give money, some that just run competitions. These, I think, offer real services, not just facilities, but actual expertise and access to IP or assets that are much more difficult to get. And then if that doesn't fit, then the third stop would be other Singapore-based programs and then other programs elsewhere, even in Australia, whether it's a medtech innovator, InnoMatch, or something that's more bespoke, custom built out of a program from the Singapore healthcare system or elsewhere. Hopefully that makes sense. And so there really is, we do not want to replicate all these great resources, but what I think is important is being intelligent about working with you and finding you the right partners and the right resources to then take the next big step. And to help that along, we have a very long list of mentor expert resources that are available on tap. So we know a lot of startups, they need resources, they need them fast, but making a headcount addition is really a tough decision, right? Because you're working very lean and mean. So here's a ad hoc, very lightweight source of expertise you can tap into. And again, that starts with a conversation, and then we'll match you up. We have people that run R&D for Johnson & Johnson, for example, Byton, or some of our own digital experts like Roberta and Chris Hardesty, who are working across a lot of the digital reimbursement issues across the region. And then whether it's India or elsewhere, you have it all here, particularly Australia with Merrilyn, starting with Merrilyn. And then on top of that is what it would be our rolling schedule of podcasts. And that's where we might draw on some of our expert resources, special guests to talk about things like predictions for 2021, the post-COVID opportunity, public-private partnerships. And then another flavor would be meet some of the multinationals, get some some real insight and advice on how to work with them, how to approach them, who to talk to, because some of these large multinationals are very complicated and very complex, and can be very frustrating for both sides. So here's an opportunity to talk to someone, particularly that's at the intersection of that, and can help direct and take care of you. So we'll do Johnson & Johnson next in June, and then Stryker's coming up in July, and then we'll have more. And of course, we'll do some repeats. But if you have any specific questions, we can also direct you to.
Yeah, we have a great lineup of speakers from VCs to multinational corporate scouts who are happy to speak to you. But this is your membership. And so if there are topics that you're interested in right away, we can deliver that.
Okay, so this is, we're kind of coming to the end of the formal presentation part, so we can take some questions. So think about your questions, and I'll try to figure out how I get to the chat line. But the bottom line is we're a nonprofit or association. We don't take any equity position. We're not scary. We want to help, and part of that strategic, unique value we can bring to the table is all these incredible corporate resources. Now, of course, you got to have the right product, and you have to put in the hard yards too. But we're here to kind of bring everybody together and provide that direction, and hopefully make great things. What you get in addition to that is you get to be part of this collective voice to regulators and industry leaders. So I know at MTAA, they run a lot of working forums, and they're working on the issues at hand. And so if you want to know what's going on, or if you want to be represented in that voice, you have that access to at MTAA. I don't know, Merrilyn, do you want to add anything to that?
Yeah, so here's some highlights of my recent work. The Australian Digital Health Agency is a government agency responsible for what digital health will look like in the Australian community. So at the recent budget announcement in May, funding has been allotted to roll out a national strategy. But first, that strategy has to be formed. So beginning in July, that the ADHA, under new leadership of this strategic plan, will be rolling out the strategic framework for digital health for all Australians. And the ADHA has invited us personally, MTAA, to the table to give input to that framework. And so we expect, although they've done some work on the framework, on the kind of initial plans, they won't be released till July or August, but then we'll be going to a workshop to inform them about what medtech industry sees is needed in digital health for all Australians. Specifically, they're interested in aged care, primary care, rural and regional health, and large tech systems that will improve that. And what do we mean by improvement? We mean improve patient outcomes. So through our working groups and forums, which you are welcome to join as part of this co-membership, no matter where you're from, you will learn and contribute to the policies that we will develop and deliver to government. Another example is we lobbied extensively in 2020 and this year to the government for a tax break for intellectual property developed and owned and held in Australia. You might have heard this referred to as the patent box. And through my advocacy strategy, I made particular point of not using the phrase patent box because only 2 years ago, the Australian government said, you're not getting your bloody patent box, which is an Australian, very negative Australian way to say no. However, we've gone from no way to here you go in a short space of time. And I was personally responsible for delivering to the House of Representatives inquiry and to the Department of Industry the importance of providing supports through the whole of life cycle of medical products not just grants for research and development, which Australia is very good at and very proud of, not conducting clinical trials, which again, Australia is very good at, but a whole of life cycle from commercialization to manufacturing, to sales, to export. And so I'm very proud to be able to say that now IP that is registered here from May 11th this year forward will enjoy a tax cut of 17%. So currently you'd be paying 25% to 30%, and that would be reduced to 17% for the products associated with that Australian held intellectual property through IP Australia. Now, the way in which that will be rolled out was just announced, and so I'm already part of a government working group involved in the mechanics of that. And so through your participation in our working groups and forums, you'll be able to tell me what I should deliver to government for you. So that's just a couple of examples. Third and final example is we have a manufacturing working group, which is developing a policy so that local people who build and make things here locally have a voice. And so I imagine that it would include a lot of our startup folks who are on the call today. And so you just simply sign up and come along to the meetings and contribute. And in that way, I know what I need to say to government. And the view that was formed most recently, again, is this whole of life cycle support from invention to export, because what does it matter if you make something, but no one will buy it? So reimbursement, procurement, these things come into it as well. And your participation in these groups will can help you in that way.
Yeah, we've had such a similar experience in Singapore, in the sense that things have changed so much in just 1 or 2 years. Singapore is slightly different in the sense that there's an economic agenda. So for Australian startups, they're really looking for support to get into Singapore, and then as a hub to other emerging markets, large populations. That's an advantage. That's something that Singapore can offer and put to the table, and that's why I think this matchup works quite well with the 1 + 1 = 3, and then also vice versa. If you're a Singapore startup or an Indian startup and you're looking to Australia, which is known to be fast-moving, progressive, and a great place to start, well, this alliance will help you bridge that too. So lots of good stuff here. So if you have any questions, we're going to move into question and answers. And I know Alicia had a question, but why don't you go ahead and type in your question? We'll try to tee that up. In the meantime, maybe Merrilyn, we talk a little bit about how this alliance works in terms of membership, because that might not be clear for everybody, or someone that's not here and wants to listen to the recording. But maybe I'll summarize it. But if you do have a question, go ahead and put it up there in the chat. But the simple program is, it runs for 6 months to the end of this year. So it's all you can eat, for example, for up to December, as an alliance between MTAA and APACMed. This is our kind of maiden voyage. That means if you sign up as a new member, you get membership essentially to MTAA and APACMed and this startup program. Now, if you're, and that's a very nominal fee. We are a nonprofit, as I said before. So we're not interested in your money, and we're not interested in equity. We're interested in really helping and finding the next big unicorn. If you're grandfathered, so let's say you're already an MTA member, then you get the benefit of this program for free. It's a bonus, and it's good for the next 6 months. And likewise, if you're an APAC member today already, then now you have a new set of resources and help in Australia for your Australian interests. So that's a win-win-win for everybody.
Yes, and at the end of the 6 months, most likely starting October, November, we'll be evaluating the strengths and opportunities and challenges of the program. And along with your voice and your feedback, it will be modified. And we I'm very excited because I expect it to be hugely successful, and I'm really looking forward to meeting you all. And so you as members will shape the work plan for 2022.
So that comes to the end of our formal presentation. There's some contact information right there below if you can see that. So you have Merrilyn and my email addresses, so feel free to email us and we'll get you going. Any questions? You're a kind of a shy group today, which is okay. Why don't we end here, and we'll send out the deck. I see people are asking for the deck. Of course, you'll get that, and then we'll repost this recorded message. Feel free to pass it along to your friends and family and other interesting startups. We're happy to have this spread as far as wide. Okay. Anything else, Merrilyn?
No, I think I would just like to say also we have a team here at MTAA. We have a marketing person, his name is Louis Radburn, and we have an events manager who's really keen to get your input for our upcoming conference in September. In fact, we have we have a slot in which I'll be asking for our startup members to present a topic. That is from the 15th to the 17th of September. And also we have a value-based procurement event coming up next month, 15th of July. I'm running the content for that. It's a one-day event in Sydney. And so as members of the Startup Alliance, with the dual membership, you'll be able to register for that. Those events are fee-based. And they have different prices because they're of different durations.
Thanks for reminding me that we also have our MedTech conference coming in October, so which is quite a large event. We'll have a few thousand attendees. I think last year it ran multiple days and it was a full-on schedule. So great experience, great opportunity to learn as well. So you got 2 events. That's part of the membership too. So even just for that, you get it pays for itself, so to speak. Okay, great. Thanks, Merrilyn. We'll talk to you soon.
Okay, all right, terrific. Nice to meet you.
Thanks, everyone.